I'm Holly and I'm going to be your nurse today. Can you tell me why you have come in today? She explains to me that she is a 40-year-old female patient and she has been feeling a little bit of pain and tenderness in, in her right breast. And also, she noticed when she felt her breast a few days ago that she felt a lump that was under her nipple on her right breast. So I'm going to do an examination and assessment of her and then educate her on what she can do about it. So the first thing that I'm going to do is ask her a few questions. Have you recently been diagnosed with breast cancer or have any cancer that you are aware of? And she says no. The second question I'm going to ask is, do you have a family history of any breast cancer in your family at all? And she says no. Okay, so the first thing that I'm going to do is just inspect her. When you're looking for signs of breast cancer, usually some symptoms or signs that you may see are change in shape of the breast or the nipple, nipple discharge that's not milk, pain in the breast area, lumps felt anywhere inside of the breast or even in the armpit area, change in breast color, skin color, swelling or redness, or nipple retraction or dimpling of the breasts. So the first thing I'm going to do is just look at her and make sure that her breasts are symmetrical and that her color is appropriate for her and that they are an appropriate size for her as well. And everything looks appropriate. And then the second thing that you would do is have the client stand up. So she would stand up and I would have her lift her arm up and lift her other arm up. And what we're doing is when she does that, we're looking for any dimpling of the skin, which could be a sign of a lump underneath the skin in the breast tissue. So as we look at that, I notice some dimpling on the right side of her breast. As we continue on with the assessment, I would have her lay down on her back as I was going to palpate her breast area and examine it for any tenderness or swelling or any lumps that I can feel. So I would take my 3 fingers and palpate along her breast area on both sides. And by doing that, I would do a light palpation, medium palpation, and deep palpation. And there I did feel about a dime-sized mass under her right nipple. So I would document that as well. I would ask her, when did you start to feel this pain? And she said she noticed it about 2 weeks ago. And then I would also ask when she noted feeling her lumps and if she's had any other signs or symptoms. And she said she noticed her lump last week, but she's had no other signs and symptoms. Since she is 40 years old, I would ask her if she's had a mammogram yet this year, and she said no. And it's recommended at 40 years old that you don't need a mammogram unless you are having signs and symptoms of breast cancer. Usually at age 50 is when you should get a mammogram, and you should get it every single 2 years. So for screening options for her, it would be a mammogram is the first step that you would take. Also a MRI, genetic testing can be done as well. So for her, I would suggest getting a mammogram, getting her set up with a mammogram, and then going from there. So some treatments for breast cancer options are surgery, chemotherapy, hormonal therapy, and radiation therapy. My advice is surgery is usually the first option that patients go to when they feel a lump in their breast. A lumpectomy is a surgery that removes the tumor out of part of the breast, and then or you can get a mastectomy, which is removing both of the breasts. Usually people do the surgery first because it's successful, and then some other treatment options are available are radiation therapy, which treats all stages of cancer and it's highly effective. Most people get radiation therapy after they get their surgery just to make sure that they kill off all the cells that are remaining, if there are any more. And then chemotherapy is usually the last thing that people would go to, or not the last thing, but the third option. This treats early stages of invasive breast cancer, and also it's for advanced stages of breast cancer. This has a lot of side effects that can come with chemotherapy, like diarrhea, fatigue. You're at an increased risk for infection. It's a lot to be aware of, and consulting with a doctor about this option is best. So here we have our patient. She's 40 years old. She came into the clinic presenting with right breast pain and tenderness and a lump under her nipple. My assessment was I palpated her breast and I felt a dime-sized lump underneath her right nipple, and also some redness and swelling to the area as well. My recommendations for this patient are to go and schedule a mammogram, and once the results of that are back, to discuss further options with her doctor on treatments and what to do from there. So my care plan for this patient is basically what to expect kind of from this next process. So my first one is anticipatory grieving, with relation to anticipated loss of psychosocial well-being, which means if someone is anticipating the loss of their breast from surgery or anything like that. So the goals with this to be continue normal life activities, identify and express feelings, and understand the process. So my nursing interventions would be provide therapeutic communication for the patient, encourage thoughts and feelings to be said, and reinforce teaching on the disease. So making sure the patient understands what is going on and understands how breast cancer works and where to go from there. Another part of the care plan can be fear and anxiety related to the cancer. So because this is new in her life and she has not experienced it all, she might be feeling a lot of fear and anxiety about this new time-changing thing. So some goals for this are displaying feelings, to appear relaxed and anxiety reduced, and demonstrate coping mechanisms. So I would encourage the patient to share her thoughts and feelings. I would provide open and safe environment for the patient to talk about her feelings. I would offer myself to the patient, explain procedures and provide opportunity for questions. I would ask the patient if she has any questions and just make sure that I can answer those to the best of my ability, and make sure that she is feeling as relaxed and comfortable with all of it as possible. The main goal is to just make the patient feel comfortable and relaxed, and let them be aware of what is going on with their situation. So thank you.